You're watching TVC Breakfast. Let's get to our next discussion now. On the 25th of August 2020, the Africa Regional Certification Commission for Polio Eradication officially declared Nigeria and the rest of Africa free of indigenous wild poliovirus. However, the country is now witnessing an outbreak of the mutant poliovirus, which is generating a lot of concern across the country. But the National Primary Healthcare Development Commission says that these non-wild polioviruses, though being reported in many other countries, are not as virulent as the wild poliovirus. The Commission says the virus originated because of normal changes in the reproduction of viruses on the environment, and that malnutrition occasioned by increasing poverty is a predisposing factor in exposed children. Although the government says it has put plans in place to curtail the spread of the virus, it is concerned about the misconceptions about the current outbreak. That's the crux of our discussion now. Joining us via Zoom to address this misconception surrounding the mutant poliovirus is the chairman of Nigeria National Polio Plus Committee, Dr. Tunji Funsho. Dr. Funsho, it's good to have you join me this morning.
Thank you for having me on your program.
Great. Now, first of all, let's commend all of you for what you're doing to ensure that the polio is stamped out of Nigeria. One can only imagine the challenges that we all face, you know, having sleepless nights to work things around and achieving this feat. But talk to us basically. Nigeria, we all celebrated when Nigeria was declared polio free. What are some of the challenges that you're facing right now with this mutant part of the virus that we're seeing or hearing about?
Thank you very much again. Good morning. When we were certified wild poliovirus free in 2020, you know, I did say before we were sleeping with both eyes open, but now that we have been certified polio free, we can sleep with one eye open. Because as long as there's, you know, polio in any part of the world, no country is safe. That is why countries that have been polio free for more than 3 decades still give their children, you know, the polio vaccine, because that is the only way they can ensure that it doesn't get reimported back into their countries, because the virus is only, you know, a plane ride away. So there is that challenge to ensure that we keep the wild poliovirus at bay. The challenges that we're facing now is with this mutant, you know, poliovirus, which, as you explained in your introduction, is a combination of factors that have led to it. Yes, you know, there are issues of malnutrition, but the thing is with viruses, once they remain in an environment for a protracted period of time and have the opportunity to be transmitting from one host to another, in this case the human host, for their survival, they mutate because they know we too are trying to get rid of them. And that is almost, you know, similar to what we're seeing with the COVID-19 with, you know, Delta, Omicron, and so on. Viruses, you know, have a tendency to mutate if they stay too long in an environment and they find hosts. So part of, you know, the challenges we're having is that we have suboptimally immunized children. COVID-19 actually put spanner in the works because we had to stop a lot of activities for about 6 to 8 months in this country in 2020, which left a large number of children unimmunized against not only polio but other vaccine preventable diseases. And then add to that the poor sanitary environment in which a large section of our population live. So you are creating an opportunity for the virus to have access, you know, to the child. Unsanitary water leads to breeding, you know, of all kinds of infections. In the case of polio virus, it is excreted in stool, gets into sewage, contaminated water from sewage gets to the child can get infected if they are not fully immunized.
All right.
So there's that aspect.
Okay. Now, Dr. Funsho, okay, let me ask this. The point there is the poliovirus have been with us for a period of time. Now that we are talking about the mutant virus, was this expected?
Yes, because we've seen it with other diseases in the past. Yes, it was not unexpected that this will happen if the conditions in which most of this population live, are not taken care of. I mean, that is just the way viruses. It was expected, and that is why we made sure that we continue to innovate to make sure that the vaccine that are produced, are getting more and more potent to ensure that they are able to reduce the tendency for these viruses to mutate. But you see, once the conditions, are rife for transmission and for mutation, there's very little you can do other than to put a lid on it. Our eventual hope is that our primary healthcare sector will be strengthened enough to deal with this disease even before it happens, as we are having now with the outbreak of the vaccine mutant, variant poliovirus.
All right.
Because if a child has the opportunity to get its immunization as at when due at primary healthcare centers, then what we are doing now, going house to house, would be totally unnecessary. It is just a stopgap effort to make sure that children who have not been able to access immunization are accessed. Because our health budget, as you may know, this year, though it has increased by about 150 billion, naira as against last year. But percentage-wise of the budget, it has actually reduced from about 7% last year to 4.5% this year. That's a far cry from the 15% that was agreed, by the AU heads of state in Abuja in 2001. So we really need, in order to prevent this kind of situations happening in the future with any other disease, for that matter,
all right,
is to ensure that we have a robust primary healthcare infrastructure, and that requires funding from all tiers of government.
All right. So what happens to the polio-free status or certification that we got now? At this time, we're seeing the mutant poliovirus. What happens to that certification?
Oh, that certification still holds true.
Oh.
Because we're certified against the wild poliovirus. Now, the wild poliovirus is very distinct from the mutant variety. And the good news about that is that, and that has happened in about 15, of the about 21 countries in the world that have had this vaccine mutant virus in the last, few years, is that when you have at least two outbreak response, that is going house to house and giving them this potent vaccine, if you do two of that, you put a stop to vaccine mutant, virus, which is not the case with the wild polio virus. So it is much easier, usually, if you have a very good quality outbreak response, which is going house to house, generally within 2 weeks and 4 weeks interval from the first dose to the second dose of the vaccine. For this particular purpose, you can put a lid to the outbreak. And that has happened in about 15 countries, of the world where we've had this vaccine mutant virus. So the scenario is different. I mean, the wild polio virus, how many years it took us to get there from when we got serious to about 22 years in Nigeria to actually, get certification, having been polio-free since 2016.
All right. As it is now, with this mutant virus, what new strategy are we going to adopt to stamp it out the way we fought the wild polio virus?
Well, the strategies are about the same.
Okay.
In the sense that it requires vaccine. We need to have the vaccines, but getting the vaccine is not enough. We need to have the vehicle to get the vaccines into the mouths of children. And that requires a robust cold chain system, which again at the primary healthcare center level, before it gets to the child. It requires, funding, as I've mentioned, earlier. It requires creating awareness, which is one of our strong points in Rotary, because Rotary is virtually in every state in the country and in every local government, to make families aware of the need to continue having their children immunized against the wild polio virus, and also bring their children out when we're having this outbreak response in those environments where we have the vaccine mutant virus. I think those are very essential elements, to succeeding. And again, I cannot stress enough, these things cost money. Like the Yoruba say, the soup that is sweet costs money. For us to really succeed and sustain our success, we require more funding, particularly to primary health care, both at the national level, though I know that is not the primary responsibility of the federal government. Primary health care is responsibility actually of local governments, but the gap needed to be filled by a tier of government. But we need to ensure that we have a robust primary health care system that is well funded and well staffed.
All right. Now, how concerned and committed are the technical partners that stood by Nigeria over the years to eradicate wild polio? How committed and concerned are they in this new phase that we're talking about, mutant poliovirus?
Well, the commitment of our partners has not waned one bit. If anything, we are at the stage where the commitment is even intensified. Our global polio eradication initiative partners, WHO, UNICEF, the CDC, and the Gates Foundation, have continued to commit our main vehicle to ensure that these things get done at WHO and UNICEF, with support, funding, and also in technical support from the Gates Foundation. Rotary supports with funding and also with man hours, in the field to ensure that the vaccine actually gets to the child when it's supposed to get to the child and in the condition it's supposed to get to the child. So the commitment has not waned. As a matter of fact, as I said earlier, it really has intensified. And we work hand in hand, the GPI partners, meeting regularly to fine-tune our response to any new challenges that may confront us in the field.
All right, share with us how differently or how peculiar when it comes to the challenges of handling this mutant poliovirus. How different is it from the wild poliovirus?
Well, it's not different in any way, except that it is milder. It doesn't cause as much paralysis as the wild poliovirus. In other aspects, it's the same. It makes a child sick. And a parent doesn't want to know whether, their children has been paralyzed by the wild poliovirus or the vaccine mutant, virus. They just know that their child is paralyzed by a virus. Whether it's polio or not is really not relevant to them. They just need their children to be protected. So in that sense, there's really not much difference. And that is why the remedy is not any different. I mean, it's to protect the virus getting to the child. And if we fail to do that, to ensure that if the virus gets to the child can fight off the virus to make sure it does not succumb, particularly with paralysis, or in the very, very rare cases, death, from the virus itself.
All right. So apart from the budgetary commitment and allocation that you mentioned earlier, what other social or technical challenges do you envisage fighting this mutant poliovirus?
Well, technical challenges, generally we face has to do with making sure that our cold chain system works. Because these vaccines have to be maintained at a certain, temperature. Otherwise they become useless. And so we have vaccine, we say vaccines are in stage 1, stage 2, stage 3, stage 4. And the label of the vaccine has an indication as to when you are in any of these different stages. So our staff in the field are trained to recognize these stages so that once it goes beyond stage 1 and 2, they don't use it anymore. A simple instance, of things like this breaking down is in Plateau State. Just the weekend before, when we had an outbreak response, one of our senior Rotarians who was monitoring got to a cold room and found that the solar freezer was not freezing, so that they can get the ice packs into the vaccine carriers that the vaccinators actually take to the homes, and the vaccinators were actually taking the ice packs to their homes to freeze in their own domestic freezers, so that at least the vaccines can remain cold in the field. And what did he discover on looking around? The solar panels were all covered with layers of dust, and all they did was to clean the solar panels, and boom, the freezers were back to operation. So those are some of the logistic issues or technical issues you face in the field, making sure that that vaccine gets to the child at the right temperature. And it can be a daunting task sometimes in rural environments where electricity is a premium, and where maintaining a generator and fueling generators can be quite expensive.
All right, share with us how, because some of these challenges that we have when it comes to the actual child, where they locate, they are either in one state or another state, and based on the statistics, we break this data down sometimes based on states, how many cases we have in this state, in that state, and all of that. How are state governments committing to this fight against the virus, especially moving to this stage now where we're talking about the mutant poliovirus? How are states committing to it?
Well, it varies from state to state. I think with due respect, to a lot of the states, we're not getting the full commitment that we require to support the program, particularly when we're doing the supplemental immunization activities. Perhaps because since Nigeria has been certified polio-free, they have more pressing responsibilities, to put their resources at, and that is part of the task that Rotarians have set up, for themselves, paying advocacy, visit, to state, governors, just to remind them, because as you know, they don't get all the information they are supposed to get because of the myriad activities they're engaged in. So one of the things that Rotarians do is to engage the state governors and explain to them, let them see how their state is performing and which areas that we require them to assist to make sure that we overcome, the current challenges with the mutant virus. So it varies from state to state. Some states are much more involved in it, and other states, seem to have moved on because we have been certified, polio-free. But this is just, like I said earlier, a paralysis is a paralysis. A parent doesn't, want to know what kind of virus it is.
All right, we cannot overemphasize the idea of publicity and awareness and enlightenment regarding this, because that is where everything starts from in the first place. Now, how much of that do we need, and how much of that is being made a priority right now when it comes to creating awareness for people to know that we still have some few hurdles here and there to cross, although we have crossed the bigger one, but we still have so much work to do?
I think we're not doing enough, of creating this awareness. And I want to use this medium to solicit the support of the media, because you have the tools. and you have the expertise, to communicate with people in the language they understand. When I say the language they understand, I'm not talking about dialectical, language. I'm talking about the mode of communication. Some people would listen to the traditional leadership. Some would listen to the religious leaders, to local influencers, to friends, and so on. Those are the channels we wish we'll be able to explore and get the media to assist us with. Of course, we need to do this on an ongoing basis, not just the occasional time that we're going to actually do outbreak responses. I mean, we face this in the field. We go to some estates, and number one, they're not aware that this exercise is going on. And number two, they don't have sufficient information to give them confidence that what we're doing, number one, is coming from the government, and number two, that the children are safe to get the vaccine. So we need to continue creating this awareness on a continuing basis to ensure that these outbreak responses, when they do occur, every household is aware, so that when we knock on their door, they say, you have come, and then allow us to have access to their children for the purpose of giving those 2 precious drops to prevent their children from succumbing to the poliovirus.
All right. Dr. Tunji Funshaw, Chairman of Nigeria National Polio Plus Committee, thank you very much for what you do, and thank you for talking to us on TVC Breakfast this morning.
Thank you for having me.
Great.